We're back at it at 2:30. 2:30, talking about fee reports. We had 2 fee reports come into our committee this year. You can find them on our committee page. One is from ANR, one is from AHS. Today we're going to talk to AHS about their fee report. I think that's all I have to tell you about the situation. You're welcome to join us and share whatever you want to share about the situation. Yes?
Report from the administration so far?
No, the administration has not made any fee requests of any kind, no. There's no fee bill or fee asks. So, given that it had been so many years that we had not received one, and there is a requirement from the statute, last year in the budget, we strengthened the statute and our fee report requests have been much, much more robust in details that we asked of the administration. And Ted at JFO can talk more about sort of what we asked for and what we received.
Ted, okay, and he's gonna justify? Ted?
He's not, we weren't planning on it today, but he will in the future about this.
Okay.
I think today we're just gonna hear from the Agency for Resources.
And would it suit you if?
There are 2 chairs and you're both welcome to sit in them.
Thank you.
Yes.
Absolutely.
And thank you, I know that it is a lot of work to put one of these together, so really appreciate you taking the time to do it. Even though you didn't have a choice.
Well, thank you for that. For the record, I'm Richard Donahue, CFO of AHS. Good afternoon. I'm here with Candace Elmquist, Finance Director 4 within the Central Office Fiscal Unit, part of my team. She was principally responsible for coordinating the aggregation of data per JFO's reporting requirements and working with our departments. So I was just going to give a quick broad overview and then hand things over to Candace to walk through more specific information in terms of our submission. So we're prepared today to discuss the memo that was submitted with the summary data of the report submission per JFO's guidance in terms of the data elements that were required. Just a quick overview of AHS. Forgive me if you are all already familiar with this. There are 6 departments within AHS: Department of Children and Families, Correctional Services, Aging and Independent Living, Mental Health, Department of Health, and Children and Families. And then there's the Central Office Fiscal Unit, which is part of the Secretary's Office. And that's where we sit. So with that, we hope to answer questions specific to the data as submitted. And the information we provide today is not to be construed as reflective of any governor's recommended budget elements that may or may not be included in the governor's budget, dovetailing with comments you made earlier. And with that, if I may, I'll hand it over to Candace.
Thank you, Rich. Hello, committee. All right, so I'd like to start with the fee form, which is a large PDF, and I did provide it to Sorsha in an Excel document. I'm happy to share my screen, or if folks have it up, I don't.
So it's, we can't post Excel documents, and so we can only post PDFs. So if you could take us on a tour of it via your computer and maybe even an Excel document, that would be easier for you to talk about. That would be great.
Rich, would you mind if we?
I do not mind at all.
It's the one with the font that's
Really small. So the fee form answers all of the required elements of the legislation, but because there were a lot of requirements of the legislation, there are a lot of columns. Just give me a second while I share. Hold on. Give me a second. Sorsha, do I have the authority to share?
Yes, you do.
Sure, I believe.
I'm not as familiar with Zoom. I'm sorry, because we
We're
use
familiar with
Teams.
Teams, yeah.
And everyone has the Excel file in there. Or will in a moment.
impossible to read. At least
Yeah, you have the Excel file in your email, so you can open that up and zoom around.
I
Yeah,
do,
we're
Sorcha.
just trying to figure out the
Don't
way
know
to
Zoom.
share.
I'm sorry.
Teams environment.
Yes, exactly.
Okay, so the share screen,
It'll be better once you have.
Thank you.
and then you have your Excel document open?
Yeah, I will.
Okay.
Okay. Beautiful. Thank you, Sorcha. I'm sorry, that was right in front of me. Okay, so this is the Excel document that the committee may be familiar with, because it's a similar format that was used to be used by the Department of Finance and Management when they were required to submit the fee form.
And they fulfilled the requirement.
Yes, when they, yes. So last year's legislation then put it in the hands of the agencies that were on schedule. So that is us, A&R. Did NRB and Vermont Veterans Home submit as well?
Yes, I've just been sort of, yes, they have absolutely submitted.
Okay.
One of them sort of like tiny addendums to the other two, but yes.
Great, so you'll see similar columns to this. So each row in this spreadsheet is a distinct fee. The way that this is set up is the fees are by department. So right up here, we have our one fee for Department of Corrections. Then we have the fees for DEVA, Vermont Health Access. Then moving down the spreadsheet, we have the fees for children and families, then the fees for mental health. We have 4 fees for Dale. And at the bottom of our spreadsheet, we have 122 fees for the Department of Health. Plus one row that is a group of fees, which is the laboratory that's run by the Department of Health. So if you're using this, it's 1 fee each for corrections and DEVA, 3 fees for children and families and mental health, 4 fees for Dale, and then the 122 plus the group for DDH. So over here, we have a description of the fee, how it's collected and what it's used for, expense-wise, the statutory reference, if there is one, moving over what special fund it's deposited into, how much of that special fund, what component of the special fund that revenue is attributed to, the current fee over here, the last year that the fee was changed, and then we get into actual receipts. So over here in our projections for 24 and 25, you're going to see that those projections for the most part are based on 23 receipts. And we went through a couple of different iterations of projections, but ultimately decided not to do like a compound annual growth rate, for example, for 3, 4, or 5 years, because we were seeing that COVID-19 effects for each of these fees just made it kind of impossible to have that be the methodology. So for the most part, 24 and 25 is going to equal 23, of course, with areas where we know that there are going to be differences, departments have taken that into account. All right. Oh, and I should also mention there are a handful of these fees for the Department of Health that are biennial. So if it's biennial on an even year, then of course we didn't use 23 receipts, we used 22.
And we spent a lot of time on OPR fees last year, which I think are quite similar to many of them.
Wonderful. Okay, so then we used JFO's, Ted's, and thank you, Ted, his instructions for how to calculate the fee if it were to be adjusted for inflation since the last date of the change. So JFO wanted that calculated in 2 ways, which are these columns V and W. The first is personal consumption expenditures price index, and the second is implicit price deflator for state and local government. All right, and then over here, our AHS departments did spend a significant amount of time this August compiling comparable fees from other jurisdictions. So we have information on Maine and New Hampshire for the committee. And if I could just walk through how I would use this information. Yes, let me pick a fee. Let's say I was interested in seafood vending. I would look at this column in the spreadsheet to see if there's information in the addendum. And here I see Okay, there's one for Maine. I'm looking for a portion of the addendum called,
Yes. Like on the 37, so you highlight the whole row.
yes, yes, I can.
That's great.
I'm looking for information in the addendum for shellfish certificates and permits and certificate application, one for Maine and one for New Hampshire. Then I'm going to change views here because I'm going to open the addendum that was submitted with me. Okay. So in the addendum, you should all have a left pane over here. Give me a second, sorry. Moving back. Okay, the program for the seafood vending facility is the food and lodging program. Okay, back here to the addendum. So I want to find the food and lodging program. Open that up. I want to go to comparable fee schedules, and then I can find what's there for Maine and what's there for New Hampshire. So for Maine, I was looking for the shellfish certificates and permits. So it's right there. And then for New Hampshire, certification application. Excellent. And I can do this for policies as well. So if there are any policies affecting the fee amount, it will be up here in A rather than B. And the name of that policy will also be in the spreadsheet. So the relevant policy here is food service establishments. Yes. Sorry.
It's okay.
Food service establishments rule is the relevant policy. So going back to the addendum, I find food service establishments rule. And I could read that to see how that policy affects the fee amount. Okay, yes.
Yeah.
Is there, I didn't catch it, when you were, the iterations laterally within a category or a program, was there a little prompt that essentially drew your attention to a fee that had not been changed within a particular span of time? Or do you regularly, literally revisit every couple of years and just ask questions about comparability of other states, inflation factors, whatever?
I can take that, Rich.
Go ahead.
So the agency was on a reporting schedule every 3 years when the fee report was required to be submitted by the Department of Finance and Management.
Yep.
So for that, we reported on all fees.
All of it, okay.
All, regardless of the last.
How long they've been in
Yes.
place?
And that, back when that was done by Finance and Management, there was a column that said, when was the last time this was
Yeah.
changed? But the comparable research was not a part of the Finance and Management fee report. That was something that was asked for this year.
And you, in this table that's in front of us right now, you have the date that they were last changed, doesn't it?
Yes. Yeah, I could go over.
But you don't have to jump ahead either.
No, it's fine. I skipped by it, so we have to go back to it.
Yeah, the date was there. Like,
There, here. Okay,
2015.
last year changed.
That was a very long time ago.
Yes, of course. And then just the last thing I'd say about this spreadsheet is that some of these fees do have other considerations. I'll minimize this. Some of these fees do have other considerations. I'm just going to scroll up for a second and use the Department of Mental Health fees as an example. For VPCH and MTCR, you see over here that fees are charged to patients based on their ability to pay. These are just, this column was required by legislation. If there's anything else the department is aware of that would affect the fee, we were required to report on it. So DMH just wants you to know that for these fees in particular, we could change it, but in the end, it's about what the patient can pay, and that's what sets their fee price for these in particular. All right, so that's all I have to say about the fee form, this large spreadsheet, and the addendum. And we could stay here if there are questions on that, or I can move on to the major observations, which is the one pager.
Why don't we go to major observations and then we can go to questions about some of the details.
Great. Give me a second.
to acknowledge it's a very awkward thing to share your screen, like share your computer inside with a bunch of people.
Oh my. Hold on, I need to stop sharing for a moment. Um,
You got it.
find the one pager. Is everyone?
We like these brief pauses, they help us think ourselves.
Up here. Well, maybe I can take this opportunity to find it on the legislative website, which would be good. So walk the committee through anyway.
I can ask a question while you're doing
Yeah.
this. Which is, I understand that you're not going to be making any recommendations around places you would want to increase fees. So I'm not going to ask you about that. What I am curious about is, are there places you're interested in reducing fees? So two that I have for policy reasons. So two I have at the top of my head that I've heard from folks is the threshold around the Department of Health fee for like very small scale food manufacturers didn't have an inflationary piece put on it, and so the threshold is now much, much lower than it was sort of designed to be in policy at first, but that's one example. Another example is corrections fees for supervision. It brings in very little money, probably takes a lot of work. And so that's another one, you know, would you be interested in eliminating that fee? Because fee bills can shift fees, they can change fees, they don't just always increase fees. So if you want to give some thoughts to reduction, if that would be of interest.
So that's a fair question.
Thank you.
I would say, you know, pending the governor's recommended budget and budget address later this month,
Yes.
we will then be able to have any conversations as may be pertinent to the recommendation specific to fees.
Because like that bakery fee might get top secret.
Because otherwise we want to answer questions specific to our submission
Great.
and not necessarily speak to any policy decisions or around either increasing, decreasing,
Okay.
or doing away with any one particular fee.
So those two are sort of questions I'd love you to answer in the future, but any others within that would be great. Can I imagine that after the budget address, you are going to come with more specifics?
So if there are any elements in the recommended budget pertaining to fees, one could assume that would be the case.
Okay. Representative,
On the topic of assume,
you know what they say about that? Sorry, I just called that.
no, I understand. I wanted to say this in front of you folks because you obviously represent the second largest department in the entire budget after transfer. And I'm struggling, as I was when Adam was here with Craig Bolio, to say, well, all this adjustment stuff is very interesting, but that's on the appropriations side. I sit on the revenue raising side. So what I want to know is, are we, or should I feel like I should make a pitch for raising revenue? And I don't know that, or I can't answer that question I ask of myself as to why I'm here if I don't know what money is carried forward or is being collected otherwise. And that's what's frustrating to me. And I know there's a collision here about doctrinal or ideological freezing of fees, but it's not helping me answer why I'm here in the Ways and Means Committee to raise revenue. So I had to say that.
So if I may, I'll answer that in two ways. One specific to AHS and then the other more from a statewide standpoint. However, I defer to finance and management regarding the statewide perspective, respectfully. So when AHS develops its budget in any given year, we take into account all funding sources. And there are instances where fees are but one component of revenue for a given program. And any fee change may not be required because of other revenue sources that allow that program to be solvent operationally. From a statewide standpoint, in terms of your question, when the governor recommends his budget for fiscal year 25, there's usually an operating statement associated with that submission that shows what the assumed funding sources of revenue are for the year. That might provide some insight into answering that more global question you have. But again, I would defer to finance and management and of course, our colleagues at JFO as well. Does that answer your question?
It's a quandary, and I don't think there's an easy answer for it. It's just, I keep hearing about appropriations, but I don't sit on the appropriations committee. I sit on the revenue committee. Thanks.
So you're going to us through this?
Now that I am set up, thank you, Sorsha. Thank you, committee, for your patience. So there was one part in the legislation last year that specifically required us to compare revenues against expenses. And in order to do that, we have to get at a level where we have an expense. So we have to take a group of fees and say, what do those fees support? That's a program, and what's the program budget?
And this, in some ways, I think, gets towards Representative Anthony's question, which is, do you actually have the revenue that you need to do the job that you're trying to do?
Yeah.
Oh, great. I'm about to answer that question. So these are preliminary FY25 revenue and budget figures, understanding that this is ahead of the governor's recommended budget. These figures are October of 23. So for ease of kind of framing the discussion, the programs here are represented into 4 categories. The first category is programs that are 100% funded by fees. And you're going to see here that in almost every row, the revenue equals the expense. The 2 rows which do not, number 1, the medical licensure program. And this is because there are biennial fees here. So every other year, we always have to use the fund balance because there were fees that were assessed the prior year. The second one is the Vermont Spay Neuter Incentive Program. It's coincidental that for 25, the projected expense is slightly higher than the revenue, but there is a special fund balance from the prior year, which DCF would draw on if the expense does end up being $285,000.
Yep.
And I assume those like magically match because you just spend whatever the fees bring in and that.
These are projections from the AHS department on what the revenue will be and what the expense will be.
And I guess that seems impressive that there's an X-ray equipment registration program that has, one can project $615 worth of fees as an expense. Does the sort of bucket of fees that are brought in sort of determine the scope of work that can happen, and the expenses always align with the revenue?
I'd have to defer to the department
To answer that specific question.
Yeah, on how their programs are set up.
But it's fair to say, answering your question maybe in a reverse manner, for example, when we closed out state fiscal year 23, none of these special funds had deficit balances.
We do get into this circular conversation about, do we only do what we can within this because that's what we have, or do we not have a deficit because we're doing everything that we think we need to provide the benefit to the public that it deserves? Hard to get at that.
Can't tell.
Representative Andrews, and then we're gonna.
I'm going to be really brief. Just kind of building off of what Representative Sims just said. You know, when I look at something like lead abatement coming in under $100,000, it begs the question, if there was more money, could we remove more harmful lead from people's homes, for example, which seems like a really good use of dollars. So I'll just leave it at that.
The ladies are correct in their speculation that we can't really tell from this chart if these figures are right.
or not? I tell you, I have a long history with fees, and I'm really impressed with this chart and also the one we've previously saw. I have never seen a chart as thorough and going back and anticipating questions like, what do other states do? I'm amazed. It's really very, very well done.
I would like to thank the department for their good work on that and also thank the graceful coaching from Joint Fiscal Office on this. But really, I think working with agencies to make sure that they're meeting our statutory intent.
Thank you for those comments, and I think it was definitely a very positive collaboration, so. Agreed.
Good job.
Representative
Carolyn, you made a comment that we're not sure if these numbers are correct.
Right.
Why would we not be sure they're correct?
We don't know how thorough they were when they looked at the books. We don't know if the clerk who came to them and said it's 144,822 if he caught everything or if he double counted a line. We don't know that. It's not certified by anyone that I can see here. So we're not certain these are correct, but it's as good as it gets, I mean, in state government.
And these are projections, as Kansas previously stated as well, based on past experience.
Yeah, right.
So Candace, thank you for, we'll take a moment for you to finish showing us this, and then we're going to spend a lot more time on this, maybe with you two again, maybe with other people from the agency in the future. Sure. And definitely JFO.
Great. All right, so first category that I talked about, fully funded by fees. Second category are programs that are partially funded by fees and partially funded by state general fund. The third category are programs that are partially funded by fees and partially funded by at least one other federal funding source. And the fourth category are fees that, I'm sorry, go ahead.
So for the ones that are just fees and expenses, it's easy to get a sense of gap or deficit in the program. For the ones where there are other revenue sources, but we don't have a column articulating those, it's harder to have a sense of whether that program is in deficit or not. Is that something that help provide?
I think I would feel comfortable saying that none of these programs are in deficit. And for example, for the public health laboratory services, the gap between the fee-funded revenue and the expense would be fully covered by global commitment investment.
And you think that's true for everything that is?
Yeah, I mean, there are a couple of items in the pink category that have multiple other funding sources. So we could get you that split if you're interested in, for example, the second one for the impaired driver program. If you want to know what percent is substance abuse prevention and treatment block grant versus general fund, we can get you that fund split.
The information submitted was specific to the fees, and that's why it's presented in this way. And this specifically answers subsection elements, I think, in the statute.
But no, I think it's important to know that none of the programs here are facing a deficit. There's always another funding source that's making up the difference.
And I guess maybe the more pointed question is, which ones have the general fund making up the difference?
The ones in blue are partially fee and partially general fund. And then there are a couple in pink that have one funding source, and then maybe general fund or global commitment is listed as a second or a third funding source.
So that dovetails with the answer to your question earlier. When we build a budget in any given year, we review all funding sources that are applicable to all programs across the agency, which may then necessitate chewing things up for one fund source versus another.
Yeah.
But then, does the fee as a percentage of the total expense of the activity, is the fee the default, or is, when I say default, does it simply result from the subtraction of alternative funding sources from the cost? Or is the fee not a default and set intentionally either relative to our neighbor states or some other touchstone?
There are specific rules related to how the fees are assessed. the information or data that goes into determining how those fees are assessed varies from fee to fee. And as Candace pointed out earlier, this is the first budget cycle where this fee report pulls in information, at least explicitly, regarding other states' practices and protocols.
And generally, I'd also say that all departments are trying to maximize federal funding sources. So if the impaired driver rehabilitation program was eligible, it is eligible for the substance abuse prevention and treatment block grant, and they had nothing else to use those expenses on, of course, they'd use that first before going to a state funding source.
That's a great point. Candace in particular oversees the revenue unit for the entire agency. We pull in $1.8 billion per year into the state treasury.
We need to wrap up.
That's kind of why I asked the default question, because in one category, you may find that the amount of money you can pull down more than makes up whatever reasonable fee charge. And so presumably what you don't need in fees in that category could be subsidized in another category where you don't want to raise the fees, but need to.
Representative Anthony, are you asking if they're able to pool their fees?
Yeah, I guess it's an OPR. My lesson from OPR is.
OPR cannot do, but you are able to do it in your budgets, right?
I'm not sure if I understand
Can you use the
pooling.
fee revenue from one
Line item to another.
program for another?
No.
You cannot.
No, there are, well, it depends on the fee,
Okay.
how the fee's structured, what the statutory provisions may be of a given fee, how the revenue associated with the given fee may be used. There is no pat answer that's applicable across the spectrum.
But
Thank you
having,
for clarifying that. Yeah, that's where I was going.
But there, typically speaking, there are guardrails around fees assessed and what those fee revenues can be used for.
Yeah.
having just compiled this report and looking at all the statute references for the fees, I'd say generally across the board, no.
Okay.
Thank you. We actually need to go to the floor. So we can go on the floor today, but thank you first, thank you so much for all your work.
Yeah, that's great
Thank you for having us.
information.
Beginning of the